Hello and welcome. This is Borno Restoration. I am Jesse Tafida. Today on the program, we will track down efforts by Governor Babagana Zulum in improving healthcare delivery to the people of the state. This sector is one of the top priorities of the Zulum 10-pact development agenda of the state. But before we track all these stories, let's bring you the latest on Borno today. This is the new phase of Ngurusoye. 1,000 shelters were constructed for 1,100 households. Just before the inauguration of the houses, Governor Babagana Zulum disclosed that this is part of his administration's commitment to rebuilding Borno as he aims to close down all IDP camps by the end of 2026.
Outlined in Pillar 6 of our 25-year development plan, we pledge to expedite the reconstruction, rehabilitation and resettlement of displaced individuals and families into secure, affordable and self-sustaining communities. Additionally, as part of our commitment to building back Borno better and stronger, we aim to close all camps by the end of 2026, inshallah.
The Ngurusoye resettlement houses has public facilities as schools, a primary healthcare center, water and other basic amenities.
The essence of our resettlement in a dignified manner is to ensure that people will start earning their means of livelihood by themselves. People shall cultivate their lands. It's not easy. No any government can afford to distribute food and non-food items to the increasing population growth of Borno State. And therefore, I urge all of them to go back to their agricultural lands. Land is not a limiting factor here.
50,000 naira cash was given to each head of household, while women also received 25,000 naira in addition to farming inputs. Elsewhere, Governor Babagana Zulum visited Termoa town where reconstruction is ongoing. He expressed satisfaction with the level of work done so far and assured to resettle the people back to their ancestral homes soon. The Borno State Contributory Healthcare Management Agency has been doing a lot in providing easy access to healthcare services to the vulnerable people of the state. Let's take this report.
Sunana Fatima Abubakar. Mun zo wannan asibitin aihuwa, an karbe mu, an mana komai kyauta da kati da kayan mamaki din da aka bamu da katin mu, an mana komai kyauta, ba mu siya komai da kuɗin mu ba. Komai sun mana kyauta, har na aihu lafiya. Na aihu lafiya kalau, sun mana komai kyauta, ba a karbi kuɗin mu ba. Kuma da muka tashi an bamu mamaki din nan da su always, su sabulu a ciki, su tawe, su auduga duka a ciki na yara duka an bamu. Mun gode Allah ya saka. Mun gode da wannan asibiti da aka buɗe mana, gaskiya muna jin daɗin shi sosai. Mun gode Allah ya ƙara ɗaukaka, Allah ya ƙara musu buɗe. Mun gode wa gwamnatin Babagana Umar Zulum da ya buɗe mana wannan asibiti kusa da gidanmu.
We have done many things from Bushma. They have enrolled 1,201 clients for us, and never a day have these people got short of drugs. Whenever they come, all the drugs the doctor prescribe or the clinicians is always available for them, and they are glad. Bushman have helped us a lot, like when our ambulance broke down, we cried to them, they approved money for the tires, of which we purchased it. And they have helped us know water going into the ward. When the state repaired the borehole, we were able to connect water to the labor wards. They have done a lot of things for us. In time of printing cards in Mafa, PSC, no client, no patient that is paying for OPD cards. All the cards are given free. Some of the time, like new arrivals, when there is no drugs, we run to Boshuma's pharmacy and he will help us with drugs needed. They have done a lot of things for us. Even in labor, we bought mama kits that we are giving Boshuma clients. When they deliver, we give them the parts and we give them any delivery, no matter what it costs. They never buy anything outside. They got everything they needed from Boshuma once the patient is enrolled. So we have another place. They help us in repairing the gates, even helping us in painting the wall and repairing the fence that had got broken down. They have helped us. No time we ask them for help that they will not answer us.
Mun gode wa Gotman da aka kawo mu nan lokacin da aka haifi yarinyar na shekara 2. Muna shan wahala wa yaron nan. Mun gode wa Gotman. Mun gode musu tun da muka haifi yaron nan muna ta fama ba mu da kudin da za mu kawo shi mu samu lafiya. Yanzu mun samu lafiyar yaron nan alhamdulillah. Mun gode wa Baba Gana Umar Zulum.
Na ji ciwo ne, bindiga na ne ya ji ni ciwo daga Dambuwa. An kawo ni nan wajen bocan a ta ɗau nauyi na amin aiki na ɗaya bai yiwu ba, kuma za a kare min aiki na 2. Na gode wa bocan a kungiyar nan. Gwamnan mu na Borno Baba Gana Umar Zulum muna mika godiya ga wajen shi da ya mana kayyatin na wannan kungiyar da suna ma mutane taimako da yawa. Ga sunan sun taimaka min, sun ɗauka nauyin komai da komai na, su suke min magunguna komai shine suke min. Ina musu godiya. Allah taimake wannan kungiyar.
Muna godiya ga gwamnatin Borno wato ko Bochma kenan bisa taimakon da suka kawo mana na tallafawa vulnerables. Akwai mutane da yawa da suke neman taimako wanda ba su da kuɗin zuwa asibiti. Wani bai da lafiya zai kwanta a gida, zai yi tunanin idan har ba da kuɗi ba zai iya zuwa ba. Amma duk da wannan gwamnati ta kawo mana tallafi haka mun ji daɗi sosai. Mutane suna samun biyan bukatunsu sosai. Marasa lafiya suna iya fitowa su zo su faɗa ba su da lafiya kuma a ba su kati kyauta, a ba su magungunan su kyauta.
Baman karako litarilan andilka kariya da kan zacoro sero godinyana hala gumna kolsi Baba Gana Umar Zulum show godinyana askirinyana kuma ba malan guro tashan gota lan karako andiro foi da kata de teda sirina da yala ajiro siri.
My name is Dr. D. Shehu Mohammed, the Medical Director of State Specialist Hospital Maiduguri. I will briefly talk on the impact of Boshma activities within the hospital. Yes, we thank God for His Excellency's vision of coming up with the Borno Healthcare Contributory Management Agency, because we've seen the impact on our indigent patients. Gone are the days when we used to have so many of the indigent patients looking for one way of sorting out their problem or the other. Most at times when it comes to taking care of their drugs, investigations and operations, and others may even involve some form of physiotherapy and some rehabilitative interventions. But with the intervention of Boshma, at the end of the day, most of the indigent patients end up smiling back home. Some end up spending maybe the other part of their condition in the hospital, within the hospital, in 2-3 weeks, 4 weeks, free without paying anything. They get their drugs free of charge. They have some form of intervention as in operations free, and even for some drugs also free. Investigations are also done free. So for an indigent person to come in here into the hospital with the proposed bill of maybe over 100 or 200,000 naira, and again we get it free of charge, I think it's quite impactful. And most of the time we see them going back to their normal daily activities. Some that have some challenges, they will be rehabilitated before turning back to their communities by way of physiotherapy and other forms of interventions. So I think Boschman's arrival is a serious step by God through His Excellency, our Executive Governor, and also the ES of the Boschman. I think he has done well and he's still doing well, and he doesn't shy away from coming into assisting most of these indigent people. At times we have some crooked way of maybe intervention by way of maybe asking impromptu, not even following the protocol, because some usually present in form of emergency. So all these emergencies have been taken care of. They never said no, whenever we have, because of the need he has, so there's always a way of maybe tackling most of these problems. And we are very, very grateful to him. By and large, the other staff of the Boschman too, they never shied away from their responsibility, they never get tired, and just like in the hospital, work is 24/7, still they are also available 24/7. And at the end of the day, having seen the enormity of number of patients that are visiting our hospital, Boschman decided to send in a desk officer that will assist our own desk officer here. So they are all around here 24/7. And whenever there are interventions that need other assistance, like all these intra-medullary or even plates, mesh, and so on, that is not available within the hospital nor within the state. So they end up coming in to assist in order for us to get our patients up and about. I think we are very grateful. The impact of those animals is unquantifiable. Many would have lost their lives if not because of their intervention. So alhamdulillah, we are very grateful to His Excellency as well as Boschman in particular.
Dauke da larura ta taɓin hankali, to kuma babanta ya rasu, ni ne na ɗauki nauyinta, kuma sai mun ɗan fita bara muke samun abin da za mu ci. Ita ma a garin fita baran da take yi, wani ya ci zarafinta da mata ciki, muka samu 'yan ma'aikatan bokiti ma suka kai mu gurin magani, suka taimaka mana da magani da su ruwa da ƙarin jini da allurai da maganuwa. Alhamdulillah yanzu gashi ta fara samun lafiya.
Assalamu alaikum, sunana Binta Adamu, ni ce majinyacin da nake kwanciya a gadon asibiti, ina fama da ciwon sickle cell. Gaskiya na gode sosai da wannan taimakon da wannan suka ɗauki nauyina na 'yan Boschman, don gaskiya na daɗe ina fama da rashin lafiyar ciwon sikila. Yau shekara na 27 zuwa 28 ina jinyan jikina, amma yanzu da zuwan Boschman gaskiya na ji daɗi sosai. Idan na ɗauki katina na tafi da shi clinic inda aka tura ni, ina samun magunguna. Gashi na zo nan asibitin Umaru Shehu, gashi na duk wani maganin da aka rubuta min da wasu allurai, komai da komai in na kai pharmacy suna ɗauka suna bani a matsayin kyauta. Da wannan katina da nake amfani da shi na Boschman, gaskiya na ji daɗin sosai, kuma ban san ma ta ina zan fara gode musu ba. Allah yi wa albarka wa shi shugaban Boschman da shi kuma gwamnanmu, ina masa godiya, kuma Allah ya sake ƙara musu hazaka akan abin da suka yi niyyar yi mana. Allah ya albarkace mu, kuma Allah ya ɗaga mu a cikin wannan jinyar da muke fama da shi. Allah ya yaye mana.
Suna na Rabeka, yana muku godiya. Yau na zo nuna godiya na da wahalan da na sha da shi wannan shekara 3 ina ta fama da shi, ina da mara bakin CDA. Ina gode ma Boschman da suka mun aiki, na gode musu sosai.
Da ko baki ba na iya gudewa sai aliki amma gashi komai ne na cikin lafiya, na gode muku da Allah ya taimaka mini. To gashi nan dai yana nuna aikin da suka mun wajen ciwon da suka mun, gashi nan wajen tiyatar yanzu na samu lafiya na gode muku sosai.
Gaskiya na ji daɗin abin da aka yi. Saboda lokacin da na zo asibitin nan baki na wa ciwo yake yi. Gaskiya na godewa da wannan kungiya na gosuma da wanda wasu a ƙarfin kuɗi ko sisi wanda suke asibiti da lafiya ya kamata su gaggauta su zo asibiti. Ana kula da mu, ana taimaka mana ba a ƙarfin kuɗi ko sisi.
Alhamdulillah suna are an bashi mai wasa mu wa banaza kurniyo so sorry. Alhamdulillah kurdo wasa na samma jiwa na sabroti na turutun fa suran kwan kwara aka yi da kuma zai zo rayuwar kurna sari na alhamdulillah kuma sauki zuwa dukkan alabara su.
My name is Dr. Bukar Abagana. I am the medical director of Dental Hospital Maiduguri, and we have been together with Bochmo for a long time since their inception, and they have been assisting the needy and then the paper patients in the state. From wherever they come, they have assisted in alleviating the medical bills of most of them, if not all. And the conditions of most of these patients, they are seriously ill with liquid angina. When I what I mean by liquid angina is a condition that is of sepsis origin, and the patients, if not managed well, in fact, there are sometimes the condition is fatal and they die off. But with the coming of Bochma, they pay for their medical bills, they pay for their medications, and then those medications are very, very expensive. They cannot even afford to pay. And some of the patients who do come IDPs, and we know the condition of IDPs, they cannot even cater for their feeding problems or their medical bills. So the organization has been assisting those patients very well, and we have been happy with them because I know we derive happiness and satisfaction by seeing them getting well and going home in a different condition.
From January to date, we have had about 400 referrals to our secondary healthcare services, where they had services for surgeries, ophthalmology surgeries, dental surgeries, physiotherapy, orthopedic surgeries. Though some of these services are beyond their packages, but there are cases that necessitated such actions to be taken.
My name is Dr. Saleh Abakaza. I am the Executive Secretary for the Borno State Contributory Healthcare Management Agency. Introducing to is actually one of the programs that we've been running, which is the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund is a federal government initiative aimed at improving access to healthcare, especially to vulnerable Nigerians, which was established by the National Health Act 2014. Since it is actually implementation, the Borno State Contributory Healthcare Management Agency has been doing a lot to ensure the full implementation of the Basic Healthcare Provision Fund, including accreditation of facilities, especially the primary healthcare facilities, and as well as the secondary healthcare facilities. In addition, we all know that the Basic Healthcare Provision is actually a catalytic fund, whereby the federal government funds 75% of the funding, while the state government also contributes 25%. What we do as far as we are concerned is that we have now been supporting about 170 primary healthcare facilities across the 24 local government areas of Borno State, with the exclusion of only three local government areas. And this is because of artificial barriers, especially that was as a result of the insecurity. These local governments were Abadam, Guzamala, and Kalabalge. But right now we are planning to scale up the enrollment processes at those local governments, especially that the state government has done a lot to resettle people back to their communities, and the insecurity has now been tamed, not as it was before. So as such, we are looking forward by the end of the year, or before the end of the year rather, to ensure that those communities who are also enrolled and who are able to also benefit from the scheme. All the secondary healthcare facilities within the state actually for fee-for-service. In capitation alone this year, in the first and second quarter, we have disbursed over 300 million naira to those 170 facilities. While for the secondary healthcare, we were able to disburse over 7 million naira to them as per fee-for-service. And this is to ensure that those vulnerable people get access to healthcare, get free healthcare services at the primary healthcare as well as the secondary healthcare level. This is apart from the basic minimum package for health. This disbursement that was done is actually aimed to improve access to healthcare, especially to the vulnerable groups, those categories of pregnant women, children under the age of 5, those people living with disability, the aged, that is those that have 65 years and above, the poorest of the poor, and then there is this category that we call those people with special needs, especially sickle cell disease patients, patients having mental illnesses and other things like that. And at the secondary care level, we also take care of funding purchasing services to those people that need maybe emergency cesarean section, because one of the things we are promoting is how we can reduce maternal and child death within the states. So as such, we are giving a lot of emphasis to maternal and child care, and this includes antenatal care, the routine antenatal care, and up to even if there is any complication, cesarean section, and other related surgeries, like it might be from the ophthalmology, and it might be dental interventions and other related interventions. In addition to that, we ensure that people have access, not only having access but also having all the necessary support that they needed. Especially we have our customer care services, whereby clients can always call to inquire about any difficulties they encountered during those interventions at the hospitals. So they can call our hotline, and through that we can actually get them. In addition to that, we have made our referral process from the primary to secondary care level very, very easy by automating it. So we have a portal, and then through the basic health care, the primary health care facilities that we are supporting, they were all able to get basic equipments for ICT, especially computers, printers, and even Wi-Fi devices. And then through the funding, they can also recharge their bundles, their data, so that they can always access in the portal. And then at the secondary healthcare level, we also have the claim portal too, whereby the secondary facilities can log into that portal and then make their claims, and then we pay them at the end of the day. So these are some of the things that we bring to actually make the healthcare very accessible to those vulnerable people. And we do these things not without challenges. And some of the challenges include artificial barriers, because Borno State is the second largest state in the country. We have a very large landmass. We are bordering 3 countries, so this is one of the challenges. So sometimes even logistics, especially during monitoring and evaluation, is actually a huge challenge because of the distance and then the pockets of insecurities within the state that you. And another thing is actually awareness, that some of the clients may not be fully aware of some of the rights that they can exercise, especially if they are denied care. They can always call through our hotlines and to complain to us, to our complaint desk, and then we will make it very swift response to their complaints. And other challenges is we need to have a lot of capacity building workshops for all the people that are participating, that is at the facility level, on how to go about referrals, how to go about claims, and what have you. And then our people are always on ground for quality assurance uses, which we do every quarter. M&E also, which we do it every time. The monitoring is always 24/7. This is to improve the quality of services at the facility level. Important challenges is that of the vulnerability status of the citizens of the state. You know, after the decade-long insurgency, a lot of people have been displaced from their livelihoods. So as such, we have a very large pool of vulnerability. So the funding may not be enough, but the state government is trying its best to see how we can improve it via the equity funding as well as the counterpart funding. And also that those development partners that are with us and then the humanitarian partners will also key into buying premiums to the people. And that will go a long way, because as far as Borno State is concerned, most of the time people cannot afford health care, and especially with the dwindling economic situation, a lot of people are finding it very difficult to actually take care of their health, and which is one of the responsibilities of the government to ensure that the federal government is doing its best by ensuring that the disbursement is always available for the states, while the state is also doing its own part by providing the counterpart funding, the equity funding, as well as other related sources of support.
And that's our package on this episode of Borno Restoration. Many thanks for watching. I am Jessie Tafida. See you next time. Bye-bye.